Creo que nos vemos
Sí.
los tres.
Sí, ahí nos vemos.
Nos veremos medio
Sí.
raros, pero. Ajá. Hay que saber aquí. Ya empezó el piso. Ya. Are we live now? No? Okay. Hi, Alissa. How are you?
I'm great, thank you. How are you?
Fine. Just give me 1 minute. Okay. We're live now.
Okay, great.
I'm gonna start the Instagram.
Okay. Yeah, let's see.
I think I already sent you the Instagram.
Okay. I'll refresh the page on the top. In the search bar, there's like a little symbol. Yeah.
Are we ready?
Okay, and then click that.
Which one? This?
Mm-hmm.
Vamos a ver un poquito para presentarme y ahorita la muevo. Okay.
There should be like a join button.
Bueno, me presento y se presentan ustedes también.
It says live.
Yeah.
Can you see
Wait.
Alissa on the Instagram?
I already did it, but I don't know if you have the request. Yes?
We see you on the Instagram, but there is no like I don't know if Alissa can be seen.
Oh, because we don't see the request on the.
Let me close.
Maybe
It was.
Oh, we're
Okay.
Okay,
This?
then click, yeah.
All right.
Um,
It just says join live, so we click join live.
Yes. Sí, ¿verdad?
She just needs to go into the live on Epidural Stimulation or Verita Neuro. I don't know what it is. And she needs to request to join.
do you see a request to join button?
Okay, so we are seeing a live.
Yes, and you just ask to join.
Go inside, and then maybe try opening it on the Instagram app.
Porque
See,
si es esa, ¿no? No me.
scroll down.
No, me neither.
Open on
Yo
the.
sí, pero claramente no soy muy hábil.
Maybe that'll help. Okay, right there on the top.
You're
Right there.
here?
Yes. And then go live with Epidural.
Oh, okay.
Okay, we figured it out. Except now I'm upside down.
Yes.
Oh, this way.
No. Click it again, and then turn. You have to turn it on.
Okay.
No, the other way. Yeah, you got it. Yes, perfect. Okay. There we go.
Okay, we're ready. Good afternoon, everyone. I'm Dr. Paulina from Verita Neuro Mexico, and I'm here with Alissa's therapist.
Hi.
And we're gonna start with the webinar of today, making a few questions for Alissa, okay? So how are you doing, Alissa? How is everything going?
It's great. Thank you so much. I'm so happy to be here and to see my two mapping therapists, Juan and Monse, and to talk with Dr. Paulina today about my experience. I'm very grateful to have a voice here and be able to share my experiences at Verita Neuro. So thank you so much.
Great. Alissa, can you introduce yourself and tell us about your condition a little bit, please?
So I'm Alissa. I'm 18 years old. I'm from Pennsylvania, USA, and I have SC3, SC4, incomplete SCI. Prior to coming to Verita Neuro, I only had movement from my shoulders and my neck, and below that I had no sensation or movement, and pretty much textbook complete SCI.
Okay. When was your accident and how was it?
So I had a fall in July of 2023, and I received the two epidural stimulators, um, actually exactly 1 year after my accident.
That's true.
Okay, great. Alissa, how did you find out about us, about the epidural stimulation treatment?
So I give all this credit to my mother. She was the one doing all the research outside of helping me out at home and taking me to rehab and appointments and all that. The research online, we found out about the clinic, and we found out about their social media, and that's how we were able to learn more about epidural stimulation and what that treatment could offer to us. For spinal cord injuries and specifically for cervical level ones too. Um, that's how we really came to discover the potential of the treatment, and we started to really explore whether or not this could be an option for me. Um, and so then we decided to go through with a consultation with Dr. Nasir to see if I would qualify for epidural stimulation.
Great. Your injury is 1 year old. So, what were your expectations before coming to the treatment?
So for this question, I'll start um, on my expectations before even knowing about epidural stimulation. Um, Knowing I had a complete spinal cord injury before going in, the prognosis wasn't very good. In the US, based on what rehab specialists and doctors and therapists were telling me, was essentially the hope was that maybe with a complete spinal cord injury, I could gain one or two more levels of function, maybe some more arm movement because I only had my shoulders at the time. So we were really just hoping to continue pushing in therapy, see if there was any spontaneous recovery that could come out of that. But my family and I were really just holding on to faith and hoping we could find some more answers or some options out there. And then once we discovered epidural stimulation as a potential option for treatment, um, I really wanted to approach treatment at Verita Neuro with no expectations in the beginning because I really had no idea how far I could progress in my 2 months at Verita Neuro. I just wanted to give it my all and do my absolute best because my understanding of spinal cord injury before going in was that every individual person with the SCI has such a unique experience. Each person, even if they have the same level of injury, can have a totally different experience. So, even though I had an understanding that I could gain voluntary movements with the stimulator on, I wasn't exactly sure what that would look like in my case. And so I was just trying to go in without any false preconceptions. And I wanted to just embrace my treatment as it was and go in and just see what I could do in the first 2 months and going forward in the next few years.
Okay, can you talk to the patients who are seeing us right now? How was the process of having a consultation, and how long after the consultation were you here, or how was everything, like all the process?
So once we found out about Verita Neuro, we decided to have a consultation near the end of March. And that's when we first met with Dr. Nasir and Hinde about seeing if I could qualify for the treatment. And that's when Dr. Nasir explained to us what epidural stimulation was and how it can benefit SCI. Really explained like what the process looks like because we really had no idea how it worked and how the mapping process looked like and um, just how the stimulator would actually contribute to creating voluntary movement. I mean, I had no idea what that would even look like at the time because it's just an unheard of something that's unheard of in the US. It's an option that's not available yet, so we didn't really have a clear picture of what this treatment would look like. So, he answered all our questions about what to expect, and if there are any risks involved, and what work I would have to put in to receive the best results. And so we decided to have a second consultation so that we could get an MRI so he could see better whether or not I could really qualify for the treatment, if anatomically how my spinal cord looks, where the damage is, and to see where exactly the lesion is, if it's within the range of, I believe it's like between T4 and T12. Correct me if I'm wrong, but in order to qualify, and there are certain requirements. So we had to make sure that everything was set before we decided to book and pursue the treatment. And so the consultation was a great time to really ask any questions about, to really understand what exactly it is and all the details, because although you can, read about it and look it up on their social media, Dr. Nusir is, I think, the best person to talk to really understand if this treatment would be an option for you and for your case. And so several months later, in July, we decided to book that as our time to finally go in for treatment.
How do you feel when you arrived to Verita Neuro?
Coming in, I was incredibly overwhelmed, just finally being there and seeing that this experience was becoming a real thing. This wasn't only a far hope. This was finally happening, and this was in the present moment. And I was just so excited to finally start and go through the surgery, go through the treatment, and start intensive therapy. I was just couldn't wait to see what was coming next and what it would finally feel like to make a voluntary contraction in my arms or my legs. And I'll talk further on what that experience is like and what exactly is involved in that process. But I just could not wait to go under the surgery. It was I remember the night of when it was the day of the surgery. I did not sleep. I was just too excited because I knew it was gonna be the moment my life would change, and I was just so excited. And getting there, it was beautiful. The hospital itself is a wonderful facility. Sabina, the patient coordinator, was incredibly welcoming and introduced us to all the staff and made sure that we were settled in for the night, and showed us around and helped us with any accommodations, any questions we had. And it was wonderful to finally meet the people who would be working with me, the doctors, the therapists there, the nurses. So it was just an overwhelmingly joyful experience to finally get there and see that progress is about to start happening.
How soon after the surgery did you start to see changes?
So it was only 2 days after the surgery. 2 days was about the time that I needed to recover until I started to really actually begin mapping and begin with the process. I knew that it would not take that long for me to finally get into therapy and actually start using the stimulators, but I was shocked to actually experience it and be wow, that's it. Just 2 days and you're already starting in therapy. And that first day we were already trying to activate each electrode to see how my body responds to each electrode and the responses that we get for each one, and to take notes and to start figuring out which electrodes to use in the mapping process to target certain muscles in the body to create a certain movement. For example, like extending the arms or closing the hands, extending the legs, bending my legs. So that first day, we were already seeing movements, and my mom and I, we were in the hospital room and just amazed at seeing that because that whole year prior, there was um, nothing like that. And to sit there and experience it firsthand and see like 2 days after the surgery, I'm already able to start working on making movements with the stimulator on. It's indescribable. I mean, it was an amazing feeling. And to continue doing that every single day, it's beautiful. It really is. So it's really it's really difficult to describe because it's really just phenomenal experience to see your body working again and moving again and doing what it should be, right? So I definitely, it was definitely an overwhelming experience, but it was beautiful.
Yeah. How was the mapping process for you? How did you find the experience and how quickly was it useful?
So in the beginning, like I said, we're first trying to figure out and understand. There's 16 electrodes, I believe, and first in the first week or so, we have to figure out what each electrode is targeting in the body. And I had two epidural stimulators implanted, so one in the cervical area of the spine and one in my lumbar area of the spine. And um, we have to test out each of the electrodes to see what muscles are contracting, if it raises my blood pressure, what's going on sensation wise, like where I can feel it. Um, and noting that, we can see later on, okay, what electrodes do we activate in order to create a program for extending your arm or closing and opening your hand for trunk control. So different functions. Um, and initially, I was still in the hospital because I was still recovering and transitioning then into the suite in the clinic. Um, and the mapping process is very intense, and you need to be prepared to really work and put in a lot of effort every single day into the physical therapy and working with your therapist to see the right balance between frequencies and pulse width and um, intensity of the voltage of the stimulation to like really get the best result for the type of movement you're trying to achieve. Let's say like for extending your arm, we have to figure out, okay, what's the best set of electrodes to create this program that will allow me to extend my arm all the way and create the smoothest and like best possible movement we can out of this program. And several times throughout the 2 months, we would have to redo the programs because as the muscles become stronger and the connections start to change and form, we would have to change the programs again and update them to catch up with how my body is sort of reacting with the stimulators. Um, and you really do have to be prepared to work because um, getting the surgery, getting the treatment is half the battle, and the rest of it is really your mindset and putting the effort to really work in therapy and do your best to try to like push through and work with the programs every day, several hours a day, and just keep training and training.
Yeah, exactly, Alissa. You said it right. It's an intense process. It's too many hours. I mean, it's around 5 to 6 hours per day, depending on the day and what's scheduled. But yeah, it's definitely intense. Tons of work. Surgery is the minor of the problems, considering that after that you need to work and work and work and keep trying every day those programs for sure. Now those programs allow you to move, right, and like to have voluntary functions and all of that. Tell me now, what is your favorite exercise going back home, and why?
I think I have several. It's hard to choose
All
between
right.
all.
No, no, no. Tell me which are your favorite ones. Don't take just one. Tell us.
I think standing is definitely one of my favorites because being able to get out of the chair since I'm in it for most of the day and being able to like put out my full weight and finally get all the way up is incredible, especially being able to do that without a standing frame and just having the supports of two parallel bars and the help of the two of my parents. Um, that my therapists were able to help them and teach them how to do this at home so that I could continue the therapies at home. And every day I try to stand up for as long as I can. Either it's 20 minutes to 40 minutes. My goal is to get an hour, but it's just incredible to be up there and see that I'm actually standing and activating those muscles to make it happen. And there isn't like a whole network of supports just holding me up, and that I'm actually doing it on my own with the assistance of, you know, my parents helping me to bring myself up. It's incredibly empowering to see that happen, especially at my injury level. That's something I didn't think was a possibility until I got there, and they stood me up for the first time, and it was scary because it's like you don't expect to be able to do something like that with a cervical level at C4. Um, not having arm movement before that, and let alone being able to stand. I mean, it's just baffling to be able to do that every day now. Um, the next thing that I think is my favorite would be, um, I think, working with my hands and just working with grabbing things and pushing myself in my chair, anything to do with my arms. I've been practicing pushing myself in a manual chair now, which has been so empowering as well because I'm finally getting out and transitioning from using a power chair that I would control with head gestures to something that's less supportive and allows me to have more freedom and use my body in a more intensive way than something that would always be supporting me, and I would be I wouldn't be engaging my muscles in the same way as I would in a manual chair. Um, so that has been a very huge improvement for me, and just a huge transition to be able to like actually work on using my arms, pushing myself. I mean, using like markers and oil pastels to like create art at home, or just grabbing things around the house to work on feeding myself. Um, anything we can get our hands on to practice using my fingers, fine motor skills, being able to like do push-ups on the parallel bars. Um, I mean, that was unimaginable before, and finally having all these possibilities and being able to be creative with physical therapy is so much fun. It's amazing to be able to finally have this to look forward to every day. So I definitely think those are my top exercises. Yes.
Amazing. Yeah. I mean, just giving an update to the people. So Alissa has two stimulators, one on the cervical area, one on the thoracic or lumbar area. And before the treatment, Alissa only had like shoulder movements. And during the treatment, I want to let people know this. She gained voluntary function or on her triceps, which is something that she didn't have before. And during the treatment, after the second or third week of epidural stimulation and training and doing mapping and doing PT, she gained voluntary functions on her triceps, which is something you still have and you are using it without the need of the epidural stimulator. Obviously, with the epidural stimulator is stronger, but to be able to gain back something voluntarily, it's amazing. She now has better trunk control. It gets better with epidural stimulation, but she has trunk control on her own, which is for me amazing. And to be able to stand up, as you say, I think it's such a wonderful change for you, right?
Yes. Incredible.
So going back a little bit, so how was a normal day at the hospital with us? Like, how would you describe like a normal day with us?
So we would start at 9 a.m. That was the beginning of our day, and that was when we would have our first 2 hour mapping session where we would focus on the upper body. So, be arms, shoulders, um, hands, everything involving the cervical stimulator. So we would spend our 2 hours mapping, tweaking the programs, training all the muscles, the triceps, hands, fingers, anything we could, stimulating the biceps, the deltoids. And then I would have, it's been a while, so I'm trying to remember exactly. I believe it was a 3 hour break.
Physical therapy
Right.
and 2 hours of
Um,
therapy.
I remember about 2 or 3 hour break. It was just for lunch, just for you to just relax, take your time,
And physical therapy.
to eat, kind of like relax for the next session because it is very intense. The 2 hours that you spend in mapping, it does take a lot out of you, especially when you're using your muscles in a new way that you typically wouldn't be before. With muscles that are below the level of injury that you weren't able to use prior to the procedure. You're burning a lot of calories. You're working your body in a way that you haven't been in such a long time. So it definitely makes you very tired. And then after that break, I would have an hour session, just regular PT with my third physical therapist. And we would usually not use the stimulators then, but it would be a good session to stretch, work on balance, sitting balance. Sometimes we would stand and we would use the stimulators for that too. We would work on different exercises, anything that I'm able to do, just even with an injury like mine, just anything, getting on the mat, just getting out of my chair and getting active. And then after that, I would have another 2 hour mapping session where we would focus on the lumbar stimulator, working on trunk control, the legs. And that's where we would focus on standing and tweaking those programs for pushing, extending the legs, hip flexion, like bending the legs and extending them. And we would also work on taking steps in the e-pacer. So a lot of the focus was on the trunk and lower body. And that would end around 4 o'clock. So our day would really was from 9 to 4, which was pretty long day when it's much more intensive and a lot longer than what you would typically find in the US. Most sessions are about 45 minutes to 1 hour, and you typically only get twice a week with what insurance can cover. Most insurances can cover if you're not paying out of pocket. So it was a big transition to work from twice a week to have to go 6 days a week from 9 to 4 and adjust to that schedule. It was very intense. Sometimes I would be in therapy 7 hours a day because I would also work on pelvic floor therapy. So that was an additional hour to the already 5, 6 hours I'm working on mapping and physical therapy with the stimulators. So that was definitely a transition, but it's something that you have to be prepared to do in order to gain the best possible results with the stimulators.
You're talking about the physical therapy also in the US, so I want to ask you, this is something that we talk a lot with the patient, but how was different the medical care and the physical therapy from the one you already have in the US?
Yes, so as I mentioned before, just the amount of therapy that's at least present in what's provided by insurance in the US compared to the intense amount of therapy that is provided for after the surgery. It's completely different, just because you're in for 5-6 hours a day, 6 days, almost 6 days a week, compared to twice a week for 45 minutes, which is very different. It's just such a big gap, I feel like, in what's being able to be provided. And it's unfortunate because with SCI you do need to stick to a regimen that's very intense, and because our bodies need that every day. We're not designed to only work twice a week, right? Our bodies work every single day. And when you have an SCI and you have paralysis, unfortunately, that's much harder to do. And you might need extra help at home, or might need assistive equipment, or it's much harder for you to get to a rehab center. And it's unfortunately not as easily accessible and widely available. And that makes it really difficult to really keep up with your body and make sure that it's at the best optimal condition to receive treatment like epidural stimulation. Making sure that your muscles, although they will atrophy, with time, with paralysis, being able to help maintain your cardiovascular health. It's so important in order to gain the best results for epidural stimulation. And I know that resources also play a part in the difference between what's available here in the US compared to the treatment I was receiving in Mexico, because obviously epidural stimulation isn't widely available in the US, and is what I believe is only available in clinical trials.
Trials, yes.
Right. So, and I believe that if it was available there, that people could make so much more progress, of course, and it could benefit millions of people living with paralysis today. But because of that lack of resources, they're not able to work with that in order to really move spinal cord injury treatment forward. So they're not working with as much resources and the knowledge that we're able to gain from that treatment. Although that they have, regular physical therapy and really nice rehab centers there, epidural stimulation really brings that to the next level. And people are able to reach a totally different goals in recovery compared to just regular physical therapy. And although you can go so far in physical therapy, epidural stimulation really sets you so much more, just puts you so much more forward and what you're able to achieve and what goals you can set for yourself. It's just a massive difference in that. And I'm sure they can explain it better than me exactly what that looks like. But it's a huge gap. It's very unfortunate.
Yeah. So, Alissa, we know part of the treatment here at Verita Neuro is epidural stimulation and the stem cell treatment, right? So, what did you know about a stem cell treatment? The other question is, how was your experience with the stem cell treatment, and what have you noticed, or what changes have you noticed after that treatment that is part of the full package that we have here?
So I know stem cells are able to target the more autonomic functions of SCI. Epidural stimulation mainly helps with the movement, of course, but also can help with blood pressure, the temperature regulation, and stem cells can really target those areas as well, bowel and bladder, blood pressure and temperature regulation as well, sensation. And so when I was in the hospital after the surgery, I got around 2 rounds of intrathecal stem cells that were administered through a lumbar puncture. I had that done in 1 week twice. It was one on Tuesday, one on Thursday, and then one round of stem cells that was administered through an IV. And I know that stem cells are most potent at 6 months post administration, but so far in the 2-3 months that I've received the stem cells, I've noticed that I've gained a lot more sensation internally in terms of when the stimulators are on. I can feel certain muscles contracting, like in my trunk. If let's say we have a trunk program on, I can feel my abdomen and my back tensing, and I can feel those muscles contracting. In my arms as well, I have greater sensation of my biceps, and I'm able to feel the contractions of my triceps and sort of the post-workout kind of burning that you get after a workout. I wasn't able to feel those sensations before. So now I'm able to feel when my muscles are getting tired, or when I've finally been using them for a long time in therapy, and I can feel the post effect of that. So with my bowel and bladder, I've gained a lot more sensation with that as well, and I'm starting to gain more control of my bowel and bladder, and that has been a huge improvement. And as many people know with SCIs, I mean, any improvement in that is huge because it's just a massive change in your day to day and your routine. And so I think it's still early because we still have time to see up until 6 months.
Yes.
The whole potential of that. But yes, I've been gaining a lot more sensations, and my temperature regulation is improved much more. And I will contribute that to both epidural stimulation and stem cells. But at night, I used to get so hot. I would need the fan, the AC, the windows open, anything to cool me down. And with an overnight program that I'm able to turn on, it's low frequency, just goes on overnight. I'm able to sleep through the night with no problems, and my heat has gone down significantly. And during the day, I used to get freezing cold, and I couldn't control my temperature if it was below 75. And now I feel much more comfortable my day to day, and that discomfort has finally gone down. My nerve pain as well has really improved. The actual device was originally for pain management, so the fact that the nerve pain has gotten better is makes sense, but it's definitely gotten better. I stopped taking gabapentin. I used to take that for my nerve pain, and I was able to get off that medication because my nerve pain has finally been tolerable enough that I can go about my day and not have it disrupted by pain. Um, so those have been the most major improvements with stem cell therapy, on top of the epidural stimulation.
Okay. Now I'd like to ask a few questions to Juan and Monse because they were the mapping therapists. And I know a lot of people have questions. We are reading the questions. Just wait a little bit and we will answer everything. Okay, please. So for Juan and Monse, how is the mapping processes and how can it help to the spinal cord injury patients? What do you think and how do you explain the patients that want to come but they don't know how it works?
You start.
Okay. Well, hi, I'm Monse, mapping therapist. Um, so the mapping helps a lot to people because it's like electrostimulation inside your body. It's like that. It's like when they put you electro, and the difference in here is that if any electrode can send a special signal to each part of your body. So our working here is to figure out which programs and which combinations will help you to grab, to release, to extend, to flexion, to stand up. That's basically our job in here.
Yeah. So adding a little bit more to that, I think the big reason why epidural stimulation is such a great thing it's because it's not only like electrical stimulation inside of you, but it's more like a neuromodulation, and it helps to activate the nerves that are still alive inside your spine but can't activate because of the scar tissue around the injury, or the inflammation process that happened in there. Some nerves will just shut down because they're not in a good environment to activate, right? So with epidural stimulation, we wake up those nerves, and that way there can be a connection between your brain, your spine, and your muscles again. So that's a huge thing, because the longer you do epidural stimulation, the more you turn on your programs, the more there will be a stronger connection between your brain and those muscles that were paralyzed. And that way, after a long time, after the long term, you will be able to move on your own again to gain more functions, just to recover, which is something that prognosis nowadays tell you that won't happen. But we know that thanks to the epidural stimulation, that may or will happen. So that's amazing. And it keeps your body in a great shape, because you don't lose your muscle mass, your nerves are good, your spine is in a better shape. So basically your joints and your bones are in such a great shape that will give you a better quality of life, and a longer life. So for me, those are the big reasons to get the epidural stimulation treatment, and that's how the mapping and all of these huge process will help you with.
So, what do you think were the biggest changes you see with Alissa, like before and after the treatment?
Well, balance control for sure. For me was a little bit difficult with her left grab hand because she was going better. We did a lot of programs with her left hand because she was going better. So that was a really it was good thing, but a little bit hard for us. But at the end, we figured it out, and we were happy.
Yes.
Yeah, for me, it's the huge progress that she had. She gained muscle mass, she gained weight here during the treatment, but not getting fat, but muscle mass. So that was a big thing for me. Um, for me, the biggest thing, and what I like the most about Alissa, is the fact that she went from having zero control on her arms to being able to have a voluntary contraction on her tricep. And by the end of the treatment, we saw muscle twitches on the biceps, which is something amazing. And she went from C4 complete to a C4 incomplete, and to have sensation and control underneath the injury. That was a huge change. That was a game changer for her, because that changes the prognosis in the long term for her. That's like a huge change in her life. Obviously, to see a C4 patient stand up on her own without any help from a standing frame or straps or whatever, it's impressive and amazing. Even for us that we have already years of experience with this, to be able to see that, it is still impresses me, and it still amazes me to see how far we could go. But to be honest, this was only thanks to how much effort she put into this. She was there every hour putting her 100% effort into this. So of course, the mapping process is really important. Of course, the experience of the mapping therapist is important, but it's more important the effort that the patient will put into the treatment. So for me, that was the most impressive thing for me, her big effort and how much muscle mass and muscle control she gained during the treatment.
Okay, talking about your long-term goals, what do you think are your goals for long term after the treatment?
Yeah, I definitely want to continue to work on standing and hopefully be able to do that more independently. I hope that I can transition full time into a manual chair and get away from using a power chair and finally be able to push myself out in the world in the community. And I hope that eventually, as I get stronger standing and gain that balance between my trunk and my legs, I'll be able to take steps, maybe using an assistive device. I hope I'll be able to finally be able to gain more independence, grooming myself, taking care of myself with my hair, my teeth, face, bathing, feeding myself, daily tasks of living, and finally gain independence and the fact that I won't need to have caregivers 24/7, especially with an injury like mine. Initially, it was really hard to swallow the fact that I had to, be dependent on people for most of everything. So it would be an amazing accomplishment and feat to be able to step away from that and do things on my own again. Be able to take care of your hygiene and be able to interact with the world around you, participate in hobbies, write, draw, play video games, feed your pets and take care of the house, be able to clean and just live, be able to enjoy life to its fullest and rather than be a passive observer of your life, really be able to interact with your world. I mean, that was one of my biggest goals. I guess it's in general, but just being able to really interact with the people and world around you. Because prior to coming to Verita Neuro and receiving epidural stimulation, it was something that I just couldn't wrap my head around and still have to struggle with. I couldn't accept the fact that I couldn't just interact with the world around me and dress myself and hug my parents or be able to shake a person's hand or be able to feed myself. I mean, it really broke my heart to see that that was supposed to be my day-to-day going forward. So having those goals set for myself and being able to work on that every single day at home has really changed my life, really changed the quality of my life. I have something to look forward to every day now, being able to actually work on myself physically. So my goal is definitely to just be able to apply all these programs and use it functionally in every single task that there is possible.
Okay. Do you find the treatment worthwhile? And what do you have a message like for all the people who are waiting for to do this treatment, but they are afraid or they don't know what to expect? Do you have a message for them?
I think that to answer the first part of your question, yes, this was beyond worthwhile. This has changed my life, and it's only been 3 months post procedure. Post my 50-day stay at Verita Neuro. My goals in life have changed, and prior to going in, I mean, we all know that with spinal cord injuries, it's so uncertain. There isn't an answer to our questions about what recovery will look like and where we will be in 10, 15 years from now, what our lifetimes will look like, because there's no answer for all these questions, like every other medical condition or disease or illness. If you break a bone, you put it in a cast and you're done in 6 weeks, right? And you can continue through life. But with spinal cord injury, there was never really an answer. And my family and I just could not accept that. And so this treatment really allowed us to finally have an answer to what we can do actively to work on getting better and recovering and moving forward with our lives. Because as you all know, spinal cord injury doesn't only affect the person who is injured, but the people around them and their families and friends. What I would advise for people who are looking to potentially pursuing this or are trying to gather the resources to finally get there is to really prepare your body, prepare your mind and body to work hard, because the moment you get there and you finally get the surgery is the moment there's no turning back. You can't give up from the moment forward, and you have to put in and really commit and know that you have to put in your all into this. This is a golden opportunity here, and um, being able to be in this position where you can receive a treatment like this and benefit from it and use it and put yourself forward is such a privilege. It's a gift, really, to be able to benefit from this and be a part of it and be one of the many patients that have received it. And um, I would say you really need to prepare yourself mentally to work hard, and from that day forward, work hard until set your goals, and push yourself every single day to be able to reach those goals that you set for yourself, because your goals will change once you receive this treatment. What you're able to do and what you're capable of will change from that day forward, and will continue to change as you continue to improve. Um, and sometimes I personally mentally have to keep up with my physical body, because there's so many improvements going on day to day that it's just baffling to see how much improvement goes on compared to the amount of progress at the rate I was progressing, um, the year going on after my accident. So it really is, half the battle is mental, compared to the physical. And best thing you can do for yourself is to never give up.
Great. Thank you, everyone. Thank you, Juan. Thank you, Monse. I don't know if you want to add something. We will answer a few questions. The questions about specific cases, we cannot answer all. I mean, if you want to know if you are a candidate for the treatment, please reach us, and we need to make a consultation. We need a CT scan or an MRI, and then we can talk about the specific injuries. But I will like to read a few questions for the therapist, and
Sure.
and also for first for Alissa. There's a question, Corey Miller. He's asking if you were taking any meds before and at the time on recovery, like gabapentin or tizanidine. I know you do, but you can answer.
Yeah, so before epidural stimulation, I was taking gabapentin, about 300 milligrams for my nerve pain, which isn't too high, but sometimes it would be a lot worse. And there were times where it would affect my sleep. Um, I was also taking Remeron to help with sleep prior to my treatment. Um, and I was also taking Midodrine for my blood pressure. I didn't mention that either, that prior to the procedure, my blood pressure was terrible. It would sit within 80/50 during the day, and I could barely even sit up straight. I couldn't sit up like this. I would have to tilt back constantly because I couldn't tolerate even sitting up. So after the surgery, I was able to get off the gabapentin, which was huge because it's one less medication, with the whole list of stuff you have to take to manage, all the other symptoms of SCI. I still take Remeron occasionally because it does help with, just being able to sleep with the lack of sensation. It's difficult for me personally. And, just the moods and anxiety and all that. But the night program has helped so much with the temperature regulation, which allows me to sleep so much better than before. And I was able to stop taking Midodrine for my blood pressure because we have 2 blood pressure programs as well. So each stimulator has its own separate blood pressure program that can help regulate that. If I'm working on standing, if I need just to pick me up in the morning after laying down the whole night and I need to get up in my chair, change positions. So getting off those three was a huge improvement.
Great.
Great. So there's this other question. It says, where was the surgery done? Is the stimulator is the stimulator equipment movable to bring home to continue stimulation? Okay, so the surgery was done in Guadalajara, Jalisco, Mexico, right? Guadalajara, Mexico, which is like in the middle part of the country, right? And is the stimulator equipment movable? Of course, like it's implanted inside of the patient. Like it's not like the electrical stimulation people is used to. It's more like an implanted device, similar to a pacemaker in the heart. So pretty similar thing, like the battery and the electrodes going into the spine. Um, they didn't do this question, but usually the battery lasts up to 20 hours of continuous stimulation. So you need to charge the battery every 20 hours of use. So you bring home a controller similar to a cell phone where you can turn on and off each program that you want. And once the mapping process is done, all the programs are in there, in the battery, in the memory, and you will be able to turn on and off any program you wish anytime you want. So yeah, the stimulator is movable because it is inside of you and you have the controller to control your programs with.
And also, it doesn't need to be removed. I see another questions about that, but the battery lasts like 8 or 10 years. So when we need to remove it, it's just a simple surgery. It's not like the stimulator surgery, but we need to remove it after 8 or 10 years just to change the battery. It is waterproof, of course. It's inside of you, so it's waterproof. You don't need to worry about water or about MRI because it's also MRI friendly. Okay. There is another question for Alissa. With the return of sensation, we worry about the increase of pain. Have you found that your pain levels have changed?
I would say my pain has gotten better, has improved because um, my sensation has been more internal. So I was able to feel more of the muscle contractions and when the stimulators are turned on and everything. But initially, I would say like the first 2 months, I was feeling more discomfort with that rather than pain because as you know, my body was adjusting to all this new stimulation. You know, the spine is like, what's going on? There's all this stimulation happening, and you know, your body's waking up after however long your body has been under paralysis. So all these new connections are waking up, and the stimulation is constantly being used day to day. So it's very new for your body again to see all that activity. So I was feeling some discomfort, not necessarily pain, just like some weird sensations here and there, and
New sensations.
but it was never like so uncomfortable that so unbearable, that I couldn't get through my day, or so painful that I needed more medications. But that eventually let up after several weeks. I guess my body just adjusted to the new stimulation, the new routine, and now not being able to get off gabapentin was huge. So my pain has definitely gotten better.
Okay. Last question. Did you participate in an inpatient rehab center in the US?
Yes, so I was, for those of you in Philly, I don't know if there's any people in Pennsylvania, but I was at inpatient McGee Rehabilitation in Philadelphia for about 2 months after being in the ICU for about a month. And it was a pretty short stay. I was expecting to stay a lot longer for my injury level, but at the time I was on a ventilator, so most of that time was spent, weaning me off onto a diaphragmatic pacer, and eventually weaning myself off of that so I could breathe on my own. But that was the extent of my stay at my inpatient rehab hospital.
Okay. For all those asking about how to know if you're a candidate, it doesn't matter if you're a complete or an incomplete injury. Also, it doesn't matter how many years you have with the injury, but we need to make a process, a consultation. We also need an MRI or a CT scan. So if you need more information about a particular case, please reach us and we will answer all your questions, okay? So I think that's all.
That's all.
That's all.
Alissa, thank you so much for your time. It is amazing to see you again and to hear about all your progress and all the good stuff that you're doing. Mama has been keeping us updated with videos of you now using your hands to do some art. Yeah, pushing
Yes.
around your manual chair. Like it's amazing to see all that progress. So keep us updated, please. We really love to see the progress of our patients. So I just want to say congratulations and keep up the good work. Okay.
Thank you
Okay,
so much for having me
I
today.
think it's important that we can just answer this one.
Yeah, does the simulator program have to be selected and run to perform a function such as yeah. So sorry. Parenthesis here. So the movement and the functions come back when the program is on. You have your program on, and you can clinch, grab stuff, move your arm, bend your arm, stand up, and whenever you turn it off, it your muscles go back to like normal as they were before. But the thing here is, the more you use the programs in the long term, the more control you will have voluntarily over the muscles. Of course, when the epidural stimulation program is on, you have voluntary control, but it gets greater and better over time. So yeah, the program needs to be on in order to be able to perform stuff, and you turn it off when you want to rest. Yeah, that's correct.
Okay. Well, thank you very much, everyone. Hola, Giovanni. Nos vemos pronto. Thank you very much for everyone, and thank you, Alissa, for joining us today.
Thank you so much for your time.
Good to
Bye,
see you.
everyone.
Thank you.